folks. In this episode of Planet ED, I will discuss this paper recently published in this American Journal of Emergency Medicine. It looked at the early crystalloid resuscitation in trauma and how much is too much. So it's an insight from a national trauma registry of the Israel. So what this study? So this was a nationwide study that was performed in the Israel. At that, what it did, it evaluated the trends in crystalloid utilization over the last decade in Israel, and it also looked at the association between this volume of crystalloid infused during the initial resuscitation phase, that's usually the pre-hospital and the ED. It included the adult trauma patients, those were at risk or were experiencing the shock after the trauma, and in-hospital mortality. So, in a nutshell, this study looked at the trends of crystalloid being used as the initial resuscitation measure after trauma, and association between the volume of that crystalloid transfused in that phase and its association with in-hospital mortality in those patients who were at risk or who were already experiencing shock. So study design and setting, this was a retrospective cohort analysis, and it just involved all the adult trauma patient. They looked at that National Registry of All Trauma Patient, and that was Israeli National Trauma Registry, and they took the data from almost the last 10 years from 2013 to 2022. So this was it was the inclusion-exclusion criteria. They included all the patients 16 years and above that were transported by this EMS from the injury scene to a hospital, and those patients out of these who had a shock with SPP of less than 90 or shock index of more than 1, either in their field or the ED. So the patient groups that were excluded from this study were those that were transferred between the facilities in the hospital, those who received the pre-hospital blood products, and those who suffered the burns. So primary outcome of this study was this all-cause mortality. So this is the result. What they found from the result is that total 10,000 plus patients were evaluated in this study. Nearly 7,000, 63% of the patients were male, and the median age was 39 years. Now, most injured patients were from the motor vehicle accidents or falls, followed by some penetrating injuries. Now, minority of patients have their traumatic brain injury as well. So this what they found, that 81% patients they suffered in this study were from the blunt traumas, and what they found that there was a trend toward the reduced crystalloid use both in pre-hospital and the ED. And what other thing they found, that crystalloid volumes of 2 liters or more were independently associated with this increased mortality. Now this was an important finding. Adjusted odds ratio was 1.4% with the confidence interval and the p-value of 0.01 for this volume of from 2 to 2.5 liter, and in those where more than 2.5 liter was transfused, the adjusted odds ratio was a bit higher, with the p-value also being significant. So what this studies tell that the overall the trend is reducing the use of crystalloid as initial resuscitation pre-hospital as well as the ED, and they say that transfusing 2 or more liters in these trauma patients as an initial resuscitation is independently associated with mortality, and with whatever the volume you're transfusing above 2 liter, the odds of mortality are increasing. Now what does this mean? Now it means that trend toward the lower utilization of crystalloids during early resuscitation in a pre-hospital and ED among trauma patients, those who are at risk of or those who are already in shock. And second thing is, now this trend is actually reflecting the steadily growing popularity of this two principles of damage control and hypotensive resuscitation, rather than giving more crystalloids and maintaining the patients with a normotension like OSPP of more than 100 or so. So this has been actually advocated from this study. So conclusion, volume displacement with 2 or more liters of crystalloids during initial resuscitation of these trauma patients is an independent risk factor for in-hospital mortality. And second, this study actually adds an important piece of evidence to that supports the principle of judicious use of flood resuscitation in trauma patients. cavity in strength. The patient sample size was good, really 10,000 patients as per the inclusion criteria. Data source was a reliable systemic data source. It was a cohort study that had a fixed inclusion exclusion criteria. That keep in mind that this only looked at the blunt trauma cases, and those trauma cases that were shocked or and then in only early resuscitative phase that started in the field by the EMS services or earlier in the ED. Now, confidence intervals were very wide as per results, but they all were in an increasing pattern. So that one thing is sure from all this data, that mortality increases with giving more crystalloids. So bottom line is that give the fluid judiciously in this early trauma patient with and should be less than 2 liters, and adopt a permissive hypotension, that just keep the systolic BP at 90 or between 90 and 100, and don't try to achieve the normotension, that it will ultimately take the patient into that triad of death that is called as the increase the coagulopathy, it would increase the acidosis, and it will increase the hypothermia. Ultimately, and now this triad of that is going to take the patient's life. So thank you.